Hello everyone, I'm Dr. Yusuf, graduated of the University of Babylon, College of Dentistry, and medical representative, laboratory skin company, Capcook team. Today, we are talking about the product Sensiken and explain the mechanism of action of potassium nitrate. But before that, we need to go through a quick introductory explanation of the neurophysiology and how the nerve signal transmitted within the neuron. Because if my understanding of the neurophysiology is weak, I will not be able to understand the mechanism of action of potassium nitrate. Okay? Now, let us imagine that the straight line represents the cell wall. Okay? This cell wall separates the neuron into two regions, inside cell and outside cell. Inside cell, I have several ions, like potassium ion in high concentration and sodium ion in low concentration. Outside the cell, we have the same ion but in reverse concentration. What does that mean? It means that I have a potassium in low concentration and sodium in high concentration. Okay? It is important to note that the electrical signal inside the cell is negatively charged and outside the cell is positively charged. Okay? Now you might ask, how can we have a positive ion like potassium and sodium inside the cell and the signal inside the cell is negative? The answer of this question is very simple. This is due to presence of negatively charged protein. Okay? And negative ion in high amount make the charge inside the cell is negative. Okay? Another important point is that the resting membrane potential of the neuron is minus 70. It means I have a negatively charged on the cell wall قيمتها minus 70. Okay? How can maintain this potential? To maintain this potential minus 70, here we have a channel called leak channel. Okay? The potassium ion move from the inside to the outside through it. Again, you might ask, how the potassium move from the inside cell to the outside cell from this channel? To answer this, we have a recall concept we studied in high school called a law of diffusion. A law of diffusion. What it say? It say that the substance move from the area of high concentration to the area of low concentration. Okay? We said before that the potassium ion inside the cell have a high concentration and the potassium outside the cells have low concentration. Okay? According to the concept of diffusion, the potassium go through the leak channel from the high concentration to the low concentration, like this. Okay? Please keep this information in your mind because it is a key point and cornerstone in our explanation. Okay? So far we have explained the normal condition of the neuron and everything now should be clear. Next we discuss what happened to the neuron when an external stimulus occurs. Now for us as dentists, the external stimulus is represented by a cold air, cold water. Let us suppose that the external stimulus come, for example, cold water. Okay? Many patients suffer from tooth sensitivity to the cold water. When the external stimulus arrive, what is the first thing that happen? The first thing happen is that the mechanically channel on the cell wall is open. This channel responding to the any outer stimulus any outer stimulus occur, this channel is opened. Now, according to what we say before about the law of diffusion, that the substance move from the high concentration to the low concentration. Now, when this mechanically channel open, the sodium enter the cells from this channel, mechanically channel. It's called mechanosensitive channel or ion channel or other. We have a many mechanically channel. Okay. What happened now when the sodium enter the cells? What happened when the positively charged sodium enter the environment that is negatively charged inside the cell? This positive ion will rise the membrane potential toward the positively direction. I mean, I have charge on the cell, it's about -70. When the sodium enter the cells and the sodium is positively charged, the cell wall charge is raised and reach to the -55 toward the positive direction. Okay, this number is very important. This number is very important. We called it the threshold. We called -55 the threshold. When the cell wall reach -55, a special pump called voltage gated sodium pump or voltage gated sodium channel is open. Okay, it's here. Here, when the cell wall charge reached to the -55, a special pump called voltage gated sodium channel is open. When this channel is open, high amount and high concentration of sodium enter inside the cell, okay, and make the cell wall potential rise to the +30. Okay, when we reach +30, the pain is occur. Now the patient suffer from pain. Okay, let's just give a quick review to what we say. At first, external stimulus, cold water, open a mechanically gated channel. A small amount of sodium entered. We can consider this amount as a spark, rising the membrane potential from -70 to the -55. At this point, the sodium pump is open. It's called voltage gated sodium pump or voltage gated sodium channel, allowing large amount of sodium enter the cells and rise the potential from -55 to the +30. Now we have sensitive, now we have pain. Now, after this, is the cycle end? Yes, it's end. But if the process end? No, of course not. The cells now want to return to the normal resting state. I mean, the cell want to return to the -70. What is the first thing occur? Focus on me. The first thing occur is that the voltage gated sodium channel is closed immediately. It makes the sodium enter through it and get rise the potential from -70 to the -55 and immediately close. Okay, why it close? To prevent continuous firing of the neuron. With sodium channel close, no more sodium enter the cells. Now the cells need to return to the -70. To achieve this, potassium ion, which is positively charged, leave the cell. Okay, potassium leave the cell from the leak channel. Okay, now focus, we lose a positive charge ion, but remember that when this cycle is come and the stimulus is occur, we have a disturbance in ion. We say we have a high potassium inside, low potassium outside, high sodium outside, low sodium inside. When this cycle is begun to start, I have a disturbance in we have a disturbance in ion. The sodium enter in high amount inside the cell, the potassium is leave the cells. So now a specific pump channel, it's called potassium sodium channel here. A potassium sodium channel, it have the responsible to re-establishing the normal ionic arrangement, bringing the neuron back to the normal state or resting state. Okay, that is a quick review of the neurophysiology. I have a 3-point. I want you to focus on it before we explain the mechanism of action of potassium nitrate. Okay, the first one, when the sodium pump is open and make the sodium enter the cells, after that the voltage gated sodium canal is closed immediately. Okay, the second one, potassium concentration is always high inside the cells and low outside the cells. The third point, to maintain the resting potential at -70, potassium ionic continuously leave the cell through leak channel 24 hours a day, moving according to the law of diffusion. Okay, this means to maintain -70 charge on the cell wall, the positively potassium ion, it's always go through the leak channel from inside cell to the outside cell. Please keep this 3-point in your mind and focus on it, because we need it when we want to explain how the potassium nitrate work. Now I want to explain how the potassium nitrate works on the level of the nerve cells. The product Sensikin toothpaste, mouthwash, gel spray contains substance called potassium nitrate. Let us first talk about the easy part, simple part. What is the benefit of nitrate? Nitrate acts as carrier for the potassium. It ensures that the potassium is delivered to the site where we need it. This is the role of nitrate. Now, thank you nitrate, you do what we want. Goodbye. Okay, now let's us focus on the potassium itself. What will potassium do? Potassium normally face a great difficulty entering the nerve cell. Why? Because the concentration of the potassium inside the cell is high. When the potassium gate in the neuron cells, it get difficulty to entering inside cell. Okay, because the potassium inside the cells is high, so it's accumulate and trapped outside the cells like this. Okay, like this. Okay, trapped and accumulate outside the cells. Remember, in the beginning we said the potassium continuously move out of the cells through the leak channel. We said before that the potassium leave the inside to the outside through leak channel 24 hours a day, because according to the law of diffusion. Okay, in our cases we increase the concentration of potassium outside the cell. This means that the potassium concentration is now high inside the cells and also relatively high outside the cells. Okay, now I have a high concentration inside, a relatively high concentration outside. What is the consequences of this situation? When the external concentration of the potassium is increased, the outflow of potassium from inside to the outside decrease, because the concentration gradient has been reduced. Okay, the second point, by decreasing the potassium outflow, more potassium that is positively charged remain inside the cells. This retention of potassium raises the membrane potential from -70 to the -60. I repeat it. Okay, when the external concentration is increased, when I have more concentration of potassium outside the cells, the outflow the outflow of potassium from inside to the outside will decrease. Why? Because the concentration gradient has been reduced. The second point, by decreasing the potassium outflow, more potassium ion that is positively charged, potassium ion is positively charged, will remain inside the cells, inside the membrane, okay, inside the cell. This retention of potassium inside the cells make the potential of the cell wall rise from -70 to the -60. Okay, please focus on this number because it is the most important thing in our product. Okay, the potassium nitrate rise the cell wall potential to the -60. In the normal way it's -70. Now it's -60. Okay, now let's us revisit the same example as before. Okay, before we say that we have external stimulus. We give an example that is cold water. Okay, and we say when external stimulus occur, a mechanically gated channel is open. If we remember, we said here we have a mechanically channel called mechanosensitive channel, ion channel, and more. Okay, mechanically, and according to the law of diffusion, the sodium enter the cells from outside to the inside because the sodium concentration outside the cells is more than inside the cells. Okay, and this we say that this we can call this a spark. Okay, and when the sodium enter the cells from this mechanical channel, the cell wall charge, okay, rise to the -55, the same of before, like we say before. What is the difference now? Previously, when the potential reached -55, we say here we have a sodium channel. Here we say we have a voltage gated sodium channel. Voltage gated sodium channel. Okay, when the potential reached -55, the sodium channel is open and allowed the large influx of sodium. Okay, this is before. In our cases, when the potential is -55 and we reach -55, okay, the sodium channel is already closed. When the sodium want to enter inside the cells, he get to the voltage gated sodium channel, but the channel is closed. Okay, now our channel is closed. ماشي. The important question now, why is the channel closed? Why is the channel closed this time? Let's us go back a little. In a previous explanation, we say that the sodium channel closes immediately after sodium enter. Okay, in order to prevent continuous firing of the neuron. We said this information before. Now, we need to clarify something important. The sodium channel does not have just two states, open and close. It's not have just to this state. It have the third state called inactivated channel. Okay, the third state called inactivated channel. When the channel is inactivated, it must go through a stage called a refractory period. Okay, a refractory period. ماشي. When the channel is activated, it must go through a stage called a refractory period. During this state, the channel is inactivated and cannot be opened even if another external stimulus occurs. Okay, Now you ask, all right, doctor, I understand the concept, but why exactly does the sodium channel remain closed in the presence of the potassium nitrate even the channel is not open? Okay, the channel is not open. We said before the channel is open and the sodium enter the inside cell and the channel close. Now the channel is not open. Why the channel is in activated stage? Why the channel now is in refractory period even if even the channel is not activated? Okay, the answer of this, when the potential rise to the minus 60, the channel interpret this as if it has already been activated before. I repeat, when the potential rise to the minus 60 millivolt, the channel interprets, channel راح تتوقع this is as if it has already been activated before. الchannel راح يتوقع انه هو قبل شوية كان مفتوح. And now it's in refractory period. It cannot be open again until the membrane potential return to the minus 70. But we use the potassium, remember that. We use potassium nitrate, so the potential never return to the minus 70. It's always remain around 60. I repeat it. I know it's hard to understand. In the past, we said before that the sodium enter the inside cell through the voltage gated sodium channel. This voltage gated sodium channel open when the cell wall charge reach minus 55. Now we have a outer stimulus called water. The mechanical channel is open. The sodium is enter inside the cells. And we reach minus 55. But when the sodium won't enter, to enter inside cell in the through the voltage gated sodium channel, the voltage gated sodium channel now is closed, inactivated. It's not closed, it's inactivated. Why it's inactivated? Because it's in refractory period. It's a refractory period. It's a refractory period. Why it's inactivated? Because when the potential rise to the minus 60, when I make the potassium in high concentration outside the cells and make the potassium retain inside the cells, because we have reduced the gradient of concentration between inside and outside, and the potassium remain inside the cells, the cell wall potential rise to the minus 60. When the potential is minus 60, the channel interpret this as if it has been already activated before. And now the channel is in refractory period. It cannot be open. Until the potential go to the minus 70. But we use the potassium. This cycle we use the Sensi Spray, Sensi Gel 2 times, 3 times daily. So it's the cell wall potential is always minus 60. So the potential remain around minus 60. And the voltage channel راح يتوقع انه اني توني مفتوح، يعني توني انفتحت وسويت شغلي، بس حاليا الان اني بالريفراكتوري بيريود مالتي. And this channel never return to the minus 70, and it's not open until the potential go to the minus 70. But when I use the potassium nitrate, the potential is always around 60, not 70. This is the mechanism of action of potassium nitrate, and this is how the potassium work on the neuron level.